Kabale Municipality MP and Chairperson of the Parliamentary Forum on Non-communicable Diseases Hon. Dr. Nicholas Thaddeus Kamara has urged the public to continuously engage in testing for non-communicable diseases to minimize their implications to the human life, helping to prevent severe complications and death. This call was made during a press conference today held at Kirigime Guest House in Kirigime Ward Southern Division, Kabale Municipality, in anticipation of the upcoming National World Diabetes Day celebrations on November 14, 2024 at Kabale Municipal Stadium. Speaking during the press conference, Dr. Kamara emphasized the financial and health burdens of diabetes, describing it as a chronic condition that requires consistent daily care. He stressed the importance of educating the public and lawmakers in NCDs, stating that as chairperson of the Parliamentary Forum on Non-communicable Diseases, he ensures that colleagues in Parliament are well informed so that they can advocate for preventive measures and better health policies.
But what does it mean? It means that every day of your life, you are going to be worse off because you are going towards complications. Secondly, it means you are also going to be spending. Every day of a chronic disease is spending. So probably the last reason you want is a real public health system, primary health care system that will cater for people with non-communicable diseases. What health system am I talking about? In fact, for me, I advocate for 90-90-90 in non-communicable diseases. That is that 90% of the people in our communities know their status in non-communicable diseases. And those 90% of the people who know their status are put on treatment. And then those who are on treatment, 90% have their blood sugar controlled, their hypertension controlled, their cancer is suppressed, and so on and so forth. And you remember that if you get HIV now, you are followed up. They do liver function tests, they do renal function tests, they do CD4 count, they do viral load. Then immediately you are put on drugs. As you are put on drugs every 6 months, or when you feel just sick, say for me today I'm feeling sick, you go there and they do all these things. This is the system we are advocating for somebody who gets diabetes, for somebody who gets hypertension, such that they can be followed up. They can be traced in the community with screening, they can be followed up, and once they are on treatment, diseases, we advocate within Parliament. We are advocates within Parliament to make sure that the MPs, first of all of them are conversant with non-communicable diseases. Secondly, they can be giving information wherever they are because they are representatives of the people. Thirdly, that they can improve appropriation of funds towards non-communicable diseases.
He further highlighted government efforts to fund the fight against non-communicable diseases, but called for further investments to match those provided to Uganda Heart Institute and Uganda Cancer Institute, and added that 1 in 4 Ugandans has hypertension, and non-communicable diseases are the leading cause of death among those over 40. Kabale District Health Educator Dr. Alfred Besgens highlighted the tendency for residents to seek medical help only when diseases have progressed, often resulting in severe complications such as kidney failure, vision loss, and more. He reported that 26,916 cases have been recorded in Kigezi health facilities, with 19 related deaths, despite the availability of diabetes treatment services at health centers, cities, and FOS facilities nationwide.
And basically want to reach every person, every individual, to know that diabetes is there, can kill once it is not diagnosed, and most importantly, can also be prevented, and even those who are already with the problem can be treated, because we have quite a number of people who are living with diabetes, but unfortunately, majority are not aware. They are there, they are living with it. They tend to come when they have already developed complications, which is not good. For last year alone, the cumulative number of patients we have in the district was actually very high, 26,916. Just a single disease. That's a very, very big number. Remember, these are the ones who are coming in the facility, either they have been taking their medicines or they are just diagonized. But we also lost 19 people. And these 19, these are people who died in hospitals. We call upon the public now to move and access this care. The only challenge we have in Africa and even in Kabale district is early seeking behavior for these services. People want to go to health facilities when they are sick. Unfortunately, by the time diabetes shows signs and symptoms, it has already damaged some organs. You're already doing badly. So, but if you're able to go early, every year, every 2 years, you're able to go do a checkup, they screen for you for diabetes. Even if they don't do a test, but they can even ask questions. They are screening questions which are very, very important.
Adding to the pressure, Dr. Geoffrey Anguyo from Kigezi Health Foundation Clinic urged the public to prioritize routine health checkups and reduce consumption of high-fat foods such as pork and sodas, which are known to exacerbate diabetes and other non-communicable diseases.
Like they said, most of the time we get people with a very high sugar level, they even don't know. Because health education is more about, when you urinate a lot, when you feel hungry, when you feel weak. But things are changing. So you find someone has a high sugar and is not getting all those. So when you come for screening, when you come for those regular testing, when it becomes part of your routine, then you test. And we have seen the trend, you see someone has been having sugar level like this, now it is changing like this. But then if you are able, every 2 months, we have put it at affordable cost. Please come for screening. And if you're a woman, we eventually screen you for the cancers. If you're a man, we screen you for prostate cancers. 40 years and above, all men are supposed to be screened. Women from 25 years supposed to be screened for those cancers. We have these services. Please utilize them.
This year's World Diabetes Day celebrated under the World Health Organization theme Diabetes and Well-Being for 2024-2026, and this year's Uganda's theme Empowering Individuals, Families and Communities for Better Diabetes Life in Uganda will feature a walk through Kabale town and exercises aimed at promoting physical activity. Samuel Omuza, Educator Vision.